Hello everyone, back again. Um, as promised, I'm going to try to give you some daily updates, at least for the first few days, um, on my transforaminal lumbar interbody fusion surgery. The surgery was actually yesterday, um, but I was in no condition to do a video yesterday. Um, it was pretty painful. I'll admit, after waking up in the recovery room, it was, I don't want to scare anybody off, but it was quite possibly the worst pain I've ever had. Um, it took a while to get the pain management synchronized and synergized with all the medications that was required to get this under control. And it took about 6 or 7 hours to achieve adequate pain control. But we ultimately did. And I'll tell you that it takes more than just narcotics. It takes muscle relaxants. It takes different types of medications, Valium, what? Anti-inflammatory medicines. My wife is here helping me do this, coaching me along the way. And it's kind of difficult to keep up with all the medications, quite frankly. But I'll tell you that it definitely requires some sophisticated pain management to gain control. The good news is that um, the surgery was at 7:30 in the morning. I got out of the recovery room at about 2 or 3, I think it was, and and then the the surgery took 3 hours to do, um, and got to the room at about 2:30 in the afternoon, and it took till about 11:30 at night before we had the pain under control. But again, as the good news is that it was um, it was achieved, and I was able to sleep last night. Um, so it's all good in the end. I'm still glad that I did it, obviously.
You were up already
And
twice, walking the
uh,
halls.
today has been remarkably better, remarkably better. Um, I've been up with physical therapy twice today, walking in the halls with a walker and with assistance. Um, I'm sitting on the side of the bed now doing this video in some pain, but taking the medications. And
This
uh,
is post-op day
so,
one.
yeah, so this is post-operative day one. Um, I wanted to kind of go back a little bit and tell you some things about my decisions to to choose Dr. Kim, Dr. Cho Kim, um, that I didn't touch on yesterday because I think I left some things out. Um, so basically, uh, oh, by the way, it was quite a wild ride getting here to San Diego. Um, we originally our flights were for 2 days before surgery, and due to the winter storm of the century, our flights got canceled the day before we were supposed to leave, and so we had to scramble to get flights. Um, we were unable to get flights into San Diego that would get us to Dr. Kim's office on time. So we got into Los Angeles and then took a car to San Diego because that got us to San Diego faster than it would have been if we had flown to San Diego, if you can imagine that. But we did go to the hospital, do the pre-admit everything, and uh, had done all the pre-op labs and medical clearances before we got here a month ago. So all that was done. And we met with Dr. Kim in the office. We went over the procedure again. Just an opportunity to ask some additional questions, which of course I had. Um, but I must say that um, Dr. Kim has been very, very patient with me. being in the medical profession myself, I'm sure that I had more questions than the average patient, more directed questions than the average patient, um, and a string of emails and a binder full of information. Took with us all my X-rays. Um, so I obviously researched this quite a bit, and uh, you know, partly my surgeon personality mixed with the knowledge of perhaps all the things that I know can go wrong, uh, made it a more in-depth discussion, if you will, about all of that and what we could expect. But after it's all said and done, I had absolutely complete confidence in Dr. Kim, and I'm very pleased that I made the decision to come here. Um, he's an extremely accomplished surgeon, trained at Harvard, and
PhD.
he's a PhD in addition to being an MD. Extremely bright, but on top of that, he's a very compassionate person as well. And to have the patience with me to endure all of my questions is a testimony to his ability to empathize with patients. I mean, he deals with patients who have severe back problems every day, and so he knows what you're going through and what I was going through. In addition to that, you know, I recognize that the quality of a physician is not necessarily in the length of his curriculum vitae and the number of papers that he's published, and he's published quite a few. But in my world as a general surgeon, I have perhaps more respect for the people who are elected to leadership positions within their respective specialties. And he is the current president of the Minimally Invasive Spine Surgery Society, which says a lot about what his peers think of him. So I think that's a very important point to make. So anyway, getting back to the day of surgery, we had to be at the hospital for 5 o'clock in the morning, and the surgery was scheduled to be at 7:15.
Back at 8:30.
Took a little time to get into the operating room, and it's interesting that when I was wheeled into the operating room, I'd seen many videos of other surgeons doing this procedure and advertising their procedure, and I saw on one video a surgeon had an intraoperative CAT scanner, which I had never seen that before in any hospital, and so when I was being wheeled into the operating room, I saw the CT scanner in the corner of the room, and I recognized it. And I asked one of the nurses, I said, oh, so I see Dr. Kim uses intraoperative CAT scan. And she was surprised that I knew about that and recognized it. She says, well, you really have done your research, haven't you? As it turns out, this type of equipment is not used in many spine centers, and it enables quite precise measurement and placement of the instrumentation. So I was not expecting to see that, but I was very pleased that I was. Got into the recovery room. As I say, the operation took about 3 hours. Eventually woke up in there, and the pain was pretty intense, and I've been through that already. And then the rest of the day was spent getting control of the pain and
Used Dilaudid.
Used IV Dilaudid,
IV.
Lortab,
Acetaminophen.
acetaminophen, IV acetaminophen, which is actually a pretty new application of IV Tylenol, which was effective. Anyway,
Robaxin.
we've been through all that. Muscle relaxants called Robaxin was the drug that we used. So anyway, flash forward to today. The pain level was, you judge pain in an operation on a scale of 1 to 10, 0 being no pain at all, and 10 being the worst pain you've ever had. Well, I can tell you that this was at least a 10 when it was at its worst. Today, when I woke up this morning, it was around a 2 or a 3. And as long as I was on my back, motionless, I didn't really have any pain at all. It was when I got up and became upright, the vertical compression, which has always been the case, is where the pain comes from. But we've been managing it pretty well today. As I say, I went to physical therapy and I got all that done. So the first day was kind of rough. The opportunity for more synchronized pain medications made a world of difference. So yeah, my wife just prompted me to tell you that there was something called a PCA pump, which stands for patient-controlled analgesia, and it's a delivery system where the patient actually pushes a button when they feel like they need pain medication. You can't give yourself too much. It's limited to deliver a certain amount, and so you can't just continually push the button and overdose. It's regulated, and there's different ways to do it, but that was one of the components that really made a big difference. So anyway, tomorrow I'm expecting for the IV fluids to be stopped. I have a catheter in, and for those of you who are men, if you have any prostate problems, it's a good idea to mention that when you go into the operating room, because there are different catheter sizes and catheter techniques that they can insert to minimize the trauma of the insertion of the catheter. So if you do have some benign prostatic hypertrophy, otherwise known as BPH, that's a good thing to mention. So I expect the catheter to come out tomorrow. The IV is going to come out tomorrow morning. We're going to try to convert to oral pain medications throughout the night and in the morning, which will enable me to be discharged on post-operative day 2, which is about as fast as you can be discharged from this type of surgery. I'm going to stay in San Diego for about a week. I'll see Dr. Kim again on Monday. The operation was done on Tuesday, so the following Monday I will do the post-operative visit, and if all things go well, and Dr. Kim has every confidence that it will, I'll be discharged to go back to New Orleans. I do have some x-rays that were taken today, and I'm going to see if I can put those on the screen here in just a second to kind of show you what the instrumentation is. I'm sorry I don't have pictures of my preoperative films to show you. Maybe I can do that at another time. But I did have some x-rays today showing the instrumentation, and so I'm going to see if I can put that in now. So hang on one second. So here you can see the screws and the rods. These are the screws on the left-hand side, connected by the rods. This is the spacer that's put in between the two vertebrae, the L4 and the L5 spacer. It's actually a cage, a titanium cage that's filled with bone graft. Some of the bone is harvested from the operation from your own bone, and some of it is synthetic bone graft. Here's the lateral view showing the screws going into each vertebral body and the rod connecting the two. So that's the whole operation. So that's all we have for tonight. I'll do another video tomorrow. Try to show you the incisions. They're only about 1 inch long, 2 incisions side by side. But I'll try to show you those tomorrow so you can get an idea of that. And until then, bye now.